Hi everyone, my name is Halina Baeva. I am an MSW intern. Today I want to talk about something that matters not just professionally but as a human topic. LGBTQ plus youth are driven by suicide at rates we cannot ignore. Let's look at what we know and what we can do. By the end of this training, three things should happen. The first, you will be able to name specific risk factors for LGBTQ plus youth. The second, you will have concrete strategies to create a safer, more affirming space. And the third, you will feel more confident using a screening approach that actually fits this population. Some numbers first. 40% of LGBTQ plus youth seriously considered suicide in the past year. They are 5 times more likely to attempt than heterosexual peers. For transgender and non-binary youth, the risk is even higher. Minority stress theory tells us it's not about identity, it's about what happens to these young people because of their identity. Not all LGBTQ plus youth face the same risk. Transgender and non-binary youth are at the highest end. Youth those families reject them are dramatically more at risk. Accepted youth are 8 times less likely to attempt suicide. LGBTQ plus youth of color face intersecting oppressions often invisible in research, and youth in child welfare are especially vulnerable and underserved. This is not a new problem. In 1973, the APA removed homosexuality from the DSM. The travel project It Gets Better, Obergefell, important milestones. But right now, over 500 anti-LGBTQ plus bills were introduced in 2023 alone. Research links this legislation directly to increased anxiety, depression, and suicidality. History matters because our clients are living it today. On the left, risk factors: family rejection, conversion therapy, homelessness, lack of affirming care. There are real experiences of youth who walk through our door. On the right, protective factors. The most powerful one trusted adult. Just one. That could be you. You do not have to fix everything. You just have to show up. 5 important things. Create an affirming environment, intake forms, language, visuals. Ask the right questions: pronouns, identity, family acceptance. Silence communicates danger. Use validated tools. Understand suicidal ideation here is often a response to external stress, not internal pathology, and know your resources. This slide comes from interview with client and LGBTQ plus youth who spent years in foster care without one safe adult. She said, I just needed someone to listen and to ask questions, not an expert, just someone present and honest. She also described candid empathy, going through the motions without actually seeing her. She knew the difference every time. So do our clients. Right now, let's practice. Alex, 17, discloses being gay but says parents don't know. Reports feeling empty, stopped seeing friends. Says, I'm fine. And right now, in small groups, discuss. What risk factors do you see? How do you open the door? What questions do you ask? What biases might come up for you? Please discuss. I give you 10 minutes, then we debrief. Right now, we will watch a short video, about 2 minutes, from the Trevor project. As you watch, notice your own reactions. What comes up for you? What do you feel? Because what we feel in the room is exactly what our clients will sense. 4 things to carry with you. LGBTQ plus youth are not fragile, they are responding to how they are treated. The most powerful intervention is often one adult who asks real questions. Affirming practice means asking, not assuming, and use your clinical tools, but inside real human relationships. You do not have to be LGBTQ plus to be a real ally. You just have to show up. Before we finish, thank you. Thank you so much. This topic matters, and I appreciate you being here and taking it seriously. LGBTQ plus youth are not statistics. They are real young people who need real adults willing to show up for them. I hope today gave you something useful, even one question you will ask differently. Thank you so much for your time.